Good morning, dears. Today we are going to deal with the clinical presentation of cancer. If a patient is having possibility of cancer, what may be the PC? In clinical practice, you know that there are some specific symptoms depending on the different nature or the different status of your patient. So we have to classify or we can understand the symptom of cancer depending on number one, seat of cancer, number two, size of cancer, number three, extent of cancer, number four, morphological peculiarity. So, the signs and symptoms of a CA patient varying from patient to patient because the symptoms may be either very non-specific or even asymptomatic one. Even though there may be symptoms, the symptoms are very subtle and the symptoms may mimicking with some other condition. All these things are because of the quality of the seat of cancer, where it is. Number two, about the size. As you know, the primary stage or primary level of cancer is known as carcinoma in situ. In such condition, you may not get any positive findings or positive symptoms. The same can be diagnosed only by doing FNAC or biopsy. So in such condition, you may not have or your patient may not have any set of symptoms. Next about the extent of symptom. As we explained in the previous classes, the invasion of CA from local area to the neighboring area, from the neighboring to the lymphatics, or from lymphatics to the bloodstream, or through the hematogenous to the different parts of our body. So which system or which organ is affected by CA, and what about the extent of that particular CA? Everything modify the symptom of our patient. And lastly, about the morphological peculiarity. As we mentioned earlier, the character or the nature of the CA may be very slow or very progressive, very mild one, and at the same time the CA may be very rapid or CA may be very aggressive and it may end in very fatal results. It means the prognosis may be very bad or very next about the, even though, let us see what can be the symptom. In a patient with symptom, the symptoms can be categorized as very general symptoms. Whatever may be the class or the size or the extent, let us see. The symptoms can be classified mainly, general symptoms can be classified mainly with a AAA. That means A. Here, the top A represents anorexia. Number two, anemia, and lastly, asthenia. So, the AAA, that is anorexia, anemia and asthenia. Being an anorexic one, the patient will not have any hungriness or the symptoms of our lycopodium. Even though a little or a small amount of food, feels a sense of satiety, or a few mouthfuls feels as a sense of satiety. That is the one of the main symptom of our lycopody. Something like that. The patient does not have any hungriness. He will not eat, or he don't want to eat anything. And being the anorexic patient, automatically our patient become anemic one also. Great anemia is there, or pallor is there, and due to anorexia and anemia, the anorexia following anemia following asthenia, that means severe weakness or great weakness, like as in case of our acid force or arsenic alb, the patient feels great prostration with a rapid sinking of vital force. That means our patient cannot do anything. Mentally, our patient is very restless, but physically very weak to move. Something like that. Great prostration is one of the main symptom of our patient. And first of all, on looking of our patient, on inspection of our patient, a cancerous patient may have usually presented with a status known as cachexia or cachexia. Why our patient become very lean, very emaciated, very shrunken, or a very weak, tired one? Because the tumor cells diverts disproportionate amount of proteins, metabolites and extracellular fluid from different parts of our body, and just simply for the growth of the tissue. Automatically our patient become very weak, lean and tired one also. These are the general presentation, and on examination there is great weight loss. One of the PC of our patient may, sir, my weight is getting very low within a very short period of time. Within 1 or 2 months, I lost near about more than 5 kg. So something like that, weight loss, unexplained weight loss. Patient does not know, or the relatives or the friends does not know why he is become that much weak. So weight loss may be the number one symptom. And next about the tiredness, extreme tiredness, fatigability. These are the very common or general symptoms. Only on the basis of the symptom of anorexia or anemia or asthenia or weight loss or tiredness or fatigability, nobody may think about the cancer. That is why a patient may get escape from we people, or the patient may get diagnosed only at the end of pathology. That means at the time of diagnosis, the CA may already spread, or metastasis may occur in different parts of our body. And next about the specific symptoms. And regarding the specific symptoms, the symptoms depending on, as we mentioned earlier, the seat size, extension and morphological character. When it affects the respiratory system, our patient may having persistent cough and dyspnea, or always having sore throat, or difficulty in swallowing, or hemoptysis may be the symptom. And when the CA affects the GIT, the sense of satiety, or pot-belliedness, or abdominal bloating, or abdominal distension, a lump feeling either by the patient or the same can be observed by the doctor. A lump over the abdomen or lymph gland over the periumbilical area, protrusion of the abdomen, or jaundice may be the symptom, or chronic diarrhea or chronic constipation may be the symptom. And we may misdiagnose the status as either as piles or a fistula or a fissure in the anal or rectal region. And when it affects the bones, severe bone pain, claudication, stitching and jerking, at that phase we may think that it may be because of any osteoarthritic or osteoporotic changes. And unusual bleeding or hemorrhage. No reason can be evaluated for the bleeding. Bleeding, especially in females, especially after position. The case may be because of any cervical cancer or lump in the breast, or in males, urinary issues. As you know, one of the main symptom of a prostate may be urinary problems like strangury or dysuria or retention or something like that. So, or non-healing ulcer may be a case of malignancy or a thickening of particular area. So it can be a thickening, or it can be an anesthetic area, or it can be a paresthetic area, it may be a lump, or it may be a growth, it may be something like that. Systemic symptoms like jaundice or ascites or diarrhea, all these symptoms can be, or it may be because of cancer. And at the same time, all these things has to be distinguished or differentiate from each and every. So these are the main symptoms. The main symptoms are nothing but anorexia, anemia, asthenia, weight loss, then with the specific symptoms. But unfortunately, all these symptoms may consider with the local systemic issues, and we may treat the patient for either for cough or for dyspnea, or the pain may be misdiagnosed as a case of peptic ulcer or something like that. The jaundice may be treated as only a case of jaundice, or the diarrhea or constipation or bleeding rectum may be treated as a case of either piles or a fistula or a fissure, and the bone pain may be treated as so something like that. The symptoms are very, very non-specific one. Only by a keen observation and about the possibility of cancer may reveal or give a clue to the early investigation and early diagnosis and early prognosis, early investigation and early management may give a better prognosis. The details can be studied in next class. Thank you for watching. Thank you.